Hey, today's we're going to go over a kind of a simple concept, but it's something that I've been doing for a while, and it seems to work, not in all situations, but I guess when it works, it works. It's not going to break the internet or anything with shocking information, so just it is what it is. So basically, what I'm trying to say is, so let's just say you're trying to take this tooth out, number 20, lower premolar, and we can just say if maybe it's a root canal tooth, or a whole tooth, it doesn't matter. The normal protocol is you kind of go in and you make your little incision, release the fibers, get in the mesial and the distal with your elevator, and try to luxate. Let's just say you do that and you get in there and it doesn't move. Like you're trying to do all this and the tooth is solid. You go to this side and you do it and the tooth is solid. Maybe there's a crown here. You don't want to make your incision up to the crown margin, which I normally don't do. So you got a lot of stuff going on here. And how do you get this tooth out? Atraumatically preserving the buccal plate, and in a lot of cases. So one little trick is, and I'll show you on the typodont first, and then I'll show you clinically how it works as well right after this. So you go in with your drill. Let's just say you've done all the little release. You tried to luxate, you tried the forceps, it's just not working out. So what you're going to do is you're going to go in just on the mesial of this root with your thin burr. I use a 701 Fisher burr, but you go in with a pinpoint. So my drill is set at 80,000 RPM at 1 to 2. And I don't always press all the way down on the rheostat on the foot pedal. So basically I'm going in, hugging the root, not on the buccal, just along this root, and I go in straight down along the root. And then once it's down there, I turn the speed up a little bit and I just fan it a little bit back and forth on the root and come out. Same thing on the distal. You go in, go down in, hug the root, fan it, come out. So what you've done here is create a little bit of space, hopefully just enough space for your elevator to have. See the point on that elevator? So that's what I'm doing. So now I'm going to use my elevator to go in that little pinpoint hole exactly where the drill went. Get in there, start luxating a little bit. And because you fanned it a little bit, the wider part of that spade can get a little deeper sometimes, and it gives you a little bit more leverage to get that tooth moving. And because you've created a little space on the distal, when you luxate here, it has more room to go distally, and then you go back to the distal and go in that one space you created and do the same thing. Okay, so now you created a little bit more space, and I don't have a forcep with me, so pretty much use pliers anyways, right? So you get your forcep on. I'm gonna open this up here. Get your forcep on. Grab your molar. If I can open this thing. Get your forcep on. Grab your molar, and hopefully you get a nice little extraction out of it. So let's see how this works clinically. Some pressure again. A little water spray. A little pressure again.